Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Very glad that you could join us once again. Did you know that C-sections are the number one surgery here in the United States? And while there have been many advancements in healthcare over the years, there's been little innovation in childbirth since the 1980s or so. Here to tell us some more is Dr. Elizabeth Cherot. She's an OBGYN, and she's joining us here to talk about some of the ways that women can manage after C-section pain and otherwise. Thank you for joining us, Dr. Cherot.
Thanks for having me, Neil.
Well, a brief background. I did say, of course, you're an OBGYN. Is that what you've always been in as far as medicine?
Yes, I've been practicing for about 20 years in New Jersey with Axia Women's Health.
Now, when we're talking about C-sections, what do expectant mothers need to know about this particular procedure?
In my practice, we hope all women have vaginal delivery, of course, but there are several women who end up with a C-section, and managing their pain is very important postoperatively. We engage patients starting at about 36 weeks about their pain management. During the surgery, we use non-opioid medications. One of them is Exparel, which is a long-acting numbing medication that we place inside the incision. And it's an opioid minimizing procedure that most women go home with no narcotic, no opioid at all.
This non-opioid pain relief, is it always inserted inside the incision, or is it something that can be taken after the surgery?
No, Exparel is a medication that is injected like you do during a dental procedure to numb up the actual incision.
A C-section is where the baby is cut out of the womb rather than, as you say, vaginal birth. After this happens, what should the mother expect, as far as pain and recovery? So
C-section is a surgery, just as you said, and it is expected there will be some pain. But using a long-acting numbing medication like Exparel, we're able to mobilize women sooner. They're able to breastfeed better, take care of themselves and their newborn in a much better fashion.
Now, when you say breastfeeding better, is that because of the lack of that level of discomfort or because of the lack of opioids in the milk?
It's both, actually. So think about being able to get up and walk sooner and move around and be able to take care of yourself and be able to adjust yourself and be able to move so that you can take care of your newborn, but also breastfeed. It's also reducing, not using an opioid, therefore that isn't excreted in the milk. Yes. So it is recommended by both the American College of OBGYN as well as pediatrics to use as little as possible.
Are these non-opioid alternatives effective 100% in procedures, or are there certain women who just aren't good candidates for a non-opioid pain alternative?
No, actually, I think all women should think about using a non-opioid, an opioid minimizing procedure. And that discussion should happen with their provider. In my practice, we use it routinely on all C-sections. But it'd be great if women had that discussion with their provider ahead of time. And so all women could experience using this medication and using less opioids.
Now, was this non-opioid alternative something that you were pursuing long before this opioid epidemic that we're calling began, or is this something that came as a result of your viewing this epidemic from a pregnancy standpoint?
Neil, that's a great question. I started in 2016 trying to really give women more. That's really what my goal was, and to have an experience that we treated them better. So starting back then, started trying to reduce the amount of opioids that a woman would take, but also trying to have them recover better. This part of my experience has been, in my practice, is something that we've, as I said, continued to use with every single provider. And as a consequence of doing this, we reduced the opioids. And as the opioid crisis was coming to light, it just kind of was in parallel.
Are there any other aspects of childbirth, pregnancy, as far as pain, discomfort? I mean, there's all kinds of things that go on when a woman is expecting. Most of those things, in my understanding, don't require any opioids or any severe pain relief. But are there instances when when other non-opioid alternatives might be useful?
Neil, we're really using them in C-sections only. Exparel is used during that procedure itself. Childbirth itself is uncomfortable, right? So, but we wanted to take this specific pathway and really make it opioid minimizing.
Dr. Cherot, where can our listeners get some more information about C-sections in general and about some of these non-opiate alternatives for recovery and pain management after a C-section?
So they can go to csectionpain.com, download a guide, bring it to their provider, and ask those questions. And I encourage all women to do so.
Great, great. Dr. Cherot, thank you so much for joining us here on the program this morning. Been a pleasure.
Thank you. Thank you so much.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.